patient receive chemotherapy, we have to be careful about distinguishing because chemotherapy induces neutropenia, and which is neutrophil count. And neutropenia generally mostly divided in 3 groups: and mild, moderate, and severe. That's based on their neutrophil count levels. So neutropenia is often expected with patients undergoing myelosuppressive chemotherapy. As acupuncturists, we should be fully aware of this condition. In one of the neutropenia, severe neutropenia, called the febrile neutropenia, is a life-threatening medical emergency. And that's defined as a fever, the treatment of fever of unknown origin without clinically or microbiologically documented infection. At that time, patient ANC is below 1,000 microliter, and they have a fever. At the same time, we will have fever over 38.5 centimeter temperature. I would suggest our colleagues to refer this NCI, the common terminology criteria for adverse event. This is the website for your reference. Well, neutropenia is a very unique condition we see in patients receiving acupuncture, receive chemotherapy, because generally neutropenia do not have symptoms until infection occurs. And they cannot be detected by the facial, tongue diagnosis, and fall diagnosis. They saw generally diagnostic method used by the TCM practitioners. They cannot be seen, they can be found. And the patient undergoing chemotherapy at risk, neutropenia can only be confirmed by laboratory CBC with the differentiation. If the patient develops febrile neutropenia, the reported death rate is very high, between 4% to 30%. That's why at Dana-Farber Cancer Institute, we established some clinical practice guidelines for treating patients. We do not recommend acupuncture if patients have ANC absolute neutrophil count below the 500, and if their platelets count less than 25,000, and if the patient has altered mental state and clinically significant cardiac arrhythmia or other unstable medical conditions, that will be determined by authorities and treating physicians. Because we established these guidelines, that's really facilitated us and benefit us to move the acupuncture practice into the major medical centers. These other additional puncture indications, for example, patients with a pacemaker and the electric acupuncture should not be used. Of course, people with neutropenia should not use acupuncture. And the lymphedema side. Lymphedema is a very common condition. And the side we should not use nearly that side. And metastatic sides also we should use acupuncture as well. And the radiation side, ongoing, if this field is a radiation side, and hopefully 4 weeks after that, and children try to avoid the sides. Patients with INR is greater than 3.5. That means they have coagulation difficulty, and we can also try to be very cautious. Patients undergoing stem cell transplantation during that time, 2 weeks prior or until 3 months after during this time, we also try to avoid acupuncture at that time. Well, this is a very interesting case. The patient comes in with complaint of the back pain, and she was asking for acupuncture treatment. As we know, back pain actually is very good, have very good results of low back pain, general back pain. And so naturally people with a patient was seeking for acupuncture treatment. However, this patient also is a later stage of lung cancer patient. You can see the scan with all these the metastasis in the back. And so that tells us we have to be very cautious for this patient. We should not use a regular acupuncture protocol to treating this kind of back pain. So there are a couple of suggestions to improve our safety measures. First of all, we should train the oncology acupuncture as from unnecessary harms and while improve the quality of life. Conclusions. Cancer patient at higher risk and due to various cancer therapies and disease progression. So as acupuncturists, we should recognize these risks, which is very, very crucial. Safety measures should be in place. Only that oncology acupuncture can be a safer practice in the world. Thank you very much.